Dr. Cassi from NAVC's Vetfolio and the host of Vet2Vet. According to AHA, about 63% of veterinarians are female, and about 87.3% of veterinary school applicants are female. So, if we're talking about a healthy future for veterinary medicine, we're talking about women's health in the workplace, and something most women will face while in the workplace: perimenopause and menopause. It happens right in the prime of our professional lives, but that doesn't have to mean it should hold us back. We're getting very real with our guest today, Dr. Liz Barton, who's speaking out about this period of transition and how current societal norms can force women out of the workplace. Dr. Barton graduated from the University of Cambridge in 2004 and enjoyed a varied clinical career. She's the founder of Vet2Vet, and Dr. Barton has written and spoken extensively on a variety of topics, including well-being, women's health, and parenting in the profession. She's driven by raising awareness and providing solutions to empower happier, healthier working lives for veterinary teams. So, Dr. Liz, thank you so much for joining me today.
I am so excited to be here and absolutely delighted that Vet2Vet is hosting this conversation. Huge thanks to Chewy for championing this as well and making this happen, because I really want to have this conversation, weird as that may sound.
No, it doesn't sound weird at all. I think it's one of these topics that really needs more attention. It needs to be brought out into the light. And so to have the opportunity to do that is exciting.
Yeah, absolutely. And I think even though all women will go through menopause, actually, I think it affects 100% of us, right? Because we all have, colleagues, friends, partners, mums, our clients as well, who will all be impacted in some way. And it goes beyond the individual, it affects our mental and physical health and therefore our relationships as well.
Absolutely. Absolutely. Well, menopause, perimenopause, these are kind of terms that we throw around very easily and have a general idea of what they refer to. But let's drill down and get a little bit more specific about what menopause is.
So the definition of menopause is the day 1 year after a woman has had her last menstrual cycle. And the average age for that is 51 years, although there is some anecdotal evidence it could be getting earlier, actually. However, the period around that, perimenopause, is actually the sort of decade before and after the menopause date itself. So typically between the ages of 45 and 55. It can occur much earlier, the sort of onset of symptoms. And really, this is the period where our hormones are starting to fluctuate. It's not a sort of linear decline in our hormones and then suddenly it ends in this sort of one date where we no longer menstruate. It's actually a really unpredictable fluctuation within and between individuals. So this decade is really where we see a lot of perimenopausal symptoms, which can be psychological and can be physical. So this is a really significant chunk of our working life, as you say, when we're sort of coming into our prime, we've got good experience, maybe our caring responsibilities are reduced and we could be sort of entering the second phase of our rejuvenating our careers, where actually we have some potentially really challenging symptoms to negotiate. And they can actually go on way beyond the sort of 55 to 60. They can actually perpetuate throughout latter life, which is like a third of our average lifespan. So really, really significant impact for the individual.
Absolutely. I'm picturing you kind of, I feel like, go through these phases in your career where you're, that new grad, and then, okay, you're starting to get your feet under you. And then, if for those of us who are parents, I know, speaking for myself personally, that takes a big toll and everything looks different. And like you said, you've been out a little while, you've got that experience, you've been doing this, have some confidence, parenting responsibilities go down a little bit as the kids get older, maybe, hopefully. And so then you really have this opportunity, and surprise, there's this other phase of life waiting around the corner.
Yeah, I sort of felt like menopause was this like crouching tiger behind the corner, which, as I sort of approached the daylight of, my kids being able to largely wipe their bottoms and their noses themselves, that I'd actually be able to kind of have this rejuvenated career. But then this sort of menopause thing was lurking, and I didn't really want to find out much about it because I was like, I'll just deal with that when it happens. It's a women's thing. I've dealt with women's things through, menstrual cycles my whole life, and I'll probably just sail through that as well. Well, I haven't sailed through necessarily, but I've hidden it and I've put up with it, and we've kind of normalized this culture of women suffering around our hormones. We kind of think it's something we should just soldier on with because it's physiological, but actually this conversation started to happen before I wanted to have it. I was hosting a Well-Vet online event during COVID lockdowns, and this conversation just started happening between some women of that sort of menopausal age, discussing how we really need to talk about this as a profession, because there's so much that we can do to empower ourselves, to manage our symptoms better, to live healthier and happier, to stay in the workplace for longer if that's what we want. And if we aren't having that conversation, then, quite often we're just putting up with it and putting up with it until the symptoms are really severe and it is impacting us at work and at home. And we could just be doing so much better for ourselves and our colleagues.
I heard something recently, and this was by no means like a vetted scientific source, so don't quote me on this, but something about like bad menstrual cramps being equivalent to the pain of a heart attack, and going, yeah, here we are, like you said, just kind of soldiering through it and going, okay, here I am, let's just keep working. And so I think you did a really good job there, just illustrating why it's so important to have these conversations, because these are while they are physiological, they're very significant physiologic things that are happening, and being able to be a little bit more open about that and say, this is what I'm experiencing and the challenges that I'm encountering, really, I think it would really do wonders for us working as a team to say, okay, how do we support each other?
Yeah, and it varies hugely between individuals, but also within the same individual as well. The fluctuations are unpredictable. Some women will sort of sail through menopause and actually find it really liberating, to sort of be free of that monthly cycle. And for them, it will be a really empowering experience, and they don't necessarily want to have the conversation around. However, we know that, both within veterinary and cross industry, around 3/4 of women will experience either physical or psychological symptoms which impact their health and well-being. Some of them quite severely, up to a third really quite severe, either mental or physical symptoms. So it's really important to tailor the conversation and any support to the individual. Even for those women who are, let's call it subclinical, who sort of sail through, they are still having, weakening bones. They're still having potential impacts on their cardiovascular system. We know that incidence of stroke goes up because of, menopausal symptoms and the effects it's having on the body. We know that older women frequently, fracture their hips and are much more likely to get fractures. So even those women who are, potentially asymptomatic, they're still having significant changes in their body, which things like, increasing movement and increasing muscle and bone loading can help to prevent. So even for those women who, don't experience obvious negative impacts, there's still things that we could be doing to keep us happier and healthier for longer.
Absolutely. And you brought up a lot of kind of where my head was going there, the symptoms of menopause. I'm wondering if we can get a little bit more specific in that regard of, so what are some of the symptoms of menopause?
Yeah, so there are sort of 34 commonly reported symptoms in the literature, but actually the breadth of symptoms is so huge that actually up to 75 in some, are quoted in some sources. And it can be everything from, physical symptoms like thinning of the hair and the skin, which can actually cause some sort of identity issues as well, through to, weight gain, through to urinary tract infections. There can be psychological symptoms as well. So increased fatigue is one of the most common symptoms. Things like reduced concentration, impacts on short-term memory, all of these things, and emotional impacts as well. It's really interesting to see where the hormones actually are interacting with our body, because it's pretty much every system there is, cardiovascular, urogenital, central nervous system. So the impacts can be literally whole body, pretty much everything you can think of. And I remember one day having like superbly burning itchy ears and thinking, what on earth is this? And I googled it, and actually, of course, it can be related to menopause symptoms. We talk about hot flushes. I didn't know that that could like literally be restricted to your earlobe. So if you almost think of any sort of malady, and potentially there is a hormonal impact on that, which can be sort of uncovered during the menopause. So even some of the psychological things that we can experience, so anxiety, or sometimes women will go through menopause before they're actually diagnosed with things like ADHD, because there's a hormonal element to how that sort of works in our brain as well. So some of these things can actually, hugely impact us. It's not just sort of hot flushes and a bit of sleeplessness. Joints can be a huge issue. A lot of women will experience hand and joint pain, and not necessarily relate that to their hormones. And the issue with not symptom tracking is that quite often there'll be a whole raft of symptoms that you're not really putting together as hormonally linked. And you're just thinking, oh, I'm getting a bit old, so I'm getting a bit creaky, and I'm not sleeping well because I've had kids and I've never kind of got into a normal sleeping pattern. And, this is just an inevitable part of sort of aging and being a vet and not having normal sleep patterns. But actually, if we start symptom tracking and we log all of these things, and then by the time we actually go and visit a physician, women will often wait until there are some quite severe symptoms. So things like crippling anxiety for people that have never had anxiety before can be quite a common trigger to actually seeking medical advice. But if you turn up at the doctor's surgery and you say, oh, I've got, anxiety or depression for the first time in my life, and you end up coming away with antidepressants, they haven't necessarily had the wider conversation of, oh yeah, I've also had achy joints, I've also not been sleeping well, I've also had recurrent urinary tract infections, my menstrual cycle is irregular, and I'm that whole kind of picture of symptoms. It's like, then actually, yes, there may well be a place for things like antidepressants, but actually that's, a very blunt tool, and it's only treating one symptom. Whereas actually, if you started potentially some hormonal therapy and or some lifestyle changes alongside that, then you're treating the whole raft of symptoms and the underlying cause, not just picking the one thing that's kind of tipped you over the edge to go and seek that help. And human physicians, some of them will have varying expertise in menopause, and some are sort of happier to talk about it than others. There are lots of tools we can use as individuals, like apps that help us to track our symptoms and to help understand what symptoms can be related to this, to empower us to have a much better conversation with medical professionals, and or to ask for a women's health specialist, because we're actually seeing that all of these things are tying up and are related, not just kind of aging or things that we have to put up with because there's no intervention that can help.
I relate it back to our patients. I know, at least speaking from my own experience, when I hear from pet owners who say, oh, well, my dog is slowing down, but he's just getting old. That's normal because he's getting old. My first reaction is to say, well, is that normal? He's not that old. And what's going on? What's the underlying cause for this slowing down? Is he in pain and he can't move around as much? Is he cushnioid and he doesn't feel good? And it sounds kind of like the same thing, not just attributing this to, oh, well, I'm just getting a little bit older, so this is what's going on. But no, there is a physiologic reason why these things are happening. And we need to give ourselves that credit too.
Absolutely. And I think we're so busy being compassionate and caring for everybody else, for our family, for our clients, for our patients, for our team, for our friends and family. And we don't necessarily extend the same kindness to ourselves. Similarly, we're always talking about preventative care and potential lifestyle interventions with our patients, feeding them a senior diet to sort of help reduce the risk of renal disease in cats, for example, and doing that preventative side of things. And there's a lot of those similar interventions we can make for ourselves. Part of the resources that we've put together for WellVet around menopause are around the pillars of a healthy lifestyle. So adjusting our sleep routine so we get better sleep, having those sort of nutritional interventions, so increasing the protein, the calcium, etc., and various other, food supplements that can actually help to support our hormones and help to support the sort of detoxification as well. And just understanding, the different things that we can do to be preventative and to put in place, even before we potentially need sort of medical therapies, which just help us to through that I'm not going to necessarily say aging process. I'm going to say through that perimenopause period, because it is related to hormones, not just getting older.
Absolutely. And I think you laid out a really great example there of how we can take care of ourselves just by symptom tracking and being aware that this may be going on, and making sure that we're seeking out appropriate medical care if that's the case. What are some other ways that we can take care of ourselves if we're experiencing perimenopause and menopause? And how can we support our team members who are experiencing the same thing?
Yeah, so I certainly think in terms of taking care of ourselves, the number one thing is, knowledge is power, right? And rather than sort of listing out a list of things, because it will actually look different for different individuals depending on their symptoms, I would say, number one, empower yourself with knowledge, learn about menopause in advance of it. I was so fortunate. This conversation started happening sort of around me, and I was asked, almost handed the mandate to go and do some research on it. And through that, I became so aware of various symptoms that the minute I had my first night sweat, I initially woke up thinking that I'd wet myself, but actually I was like, oh no, it's like all over me. What is this? And then, very quickly the penny dropped. Ah, I've just had my first night sweat. And then I was really able, because I got that knowledge, over the following year, to kind of put in place lifestyle interventions, which meant as my symptoms then started ramping up and ramping up, I was in a much better place, much more empowered, and already in those kind of better habits to manage those symptoms. So please empower yourselves. If you're in the 20s and 30s, and actually menopause can happen much earlier. Some of us have to go through medical or surgically induced menopause, way before a sort of physiological one. So whatever age you are, please empower yourselves with this. In terms of supporting our teams, again, there are some sort of general principles, but the number one is sort of listen and talk to the individual. What interventions do they need? They may not know, so it's a really nice thing to sort of have a menopause policy in place, which has a list of potential things that could be done. So simple things like temperature control in the consulting room or in the building. Sort of temperature friendly clothing, so that you're not in sort of hot, sweaty materials, and you actually have that freedom to have slightly looser, cooler clothing if you need it. Being near the sort of toilet facilities. Because that can be a real sort of need. Adding in additional breaks where needed, because the way I think about it, it's much better to, maybe have one or two consults less, for somebody that's experiencing symptoms per day, than have that person have to sort of step away from practice altogether, or maybe reduce their days for symptom management, etc. So, making small interventions just to support people, flexible working options, that kind of thing. So those are some of the practical things. But in terms of the bigger conversation, just raising awareness with your team, and reducing the taboo and stigma around this, I think universally are accepted as the most powerful measures you can make as a team, as a practice, as a workplace. There's a lot of sort of gendered ageism that can come out through even microaggressions, like, oh, having a hot flush, are you? Or brain a bit foggy today, is it? Or or you're very forgetful at the minute. And that can cause us to withdraw. We know that these microaggressions across different intersectionalities can actually really cause people to withdraw and not feel seen and heard. So I think just being aware of that, calling those out, letting people know that, this is very real, and some of the symptoms are life-threatening and crippling. So we really have to be sensitive to this. and you make these adjustments for people that are experiencing symptoms due to perimenopause, it's also, applicable to anybody else that's going through similar mental and psychological or physical related conditions as well. So you're actually facilitating pretty much everybody in the workplace to live happier and healthier.
Absolutely. And I think, what you said there about reducing the taboo around talking about this, I think really empowers us to be able to ask for the things that we need. Like you said, temperature control or, a different uniform, different clothing so that, we can feel a little bit more comfortable, because that's a really powerful message that you're sending of, if we can make these accommodations, whether it's for menopause, perimenopause, or for something else, and yes, it may cost us one or two consults, but we keep that person in the field for 10 extra years, well, it seems like a no-brainer.
Yeah, one of the other things I've found is some health insurance policies don't actually cover menopause support either. So just simple things like, making sure that your health insurance provider actually covers, menopause treatment and investigation can be a really powerful thing as well.
I think, when you talk about doing research and educating ourselves around the symptoms of menopause, I think that's another area that I had no idea that insurance policies wouldn't cover something that is, essentially an inevitability. And so that sounds like a really important part of educating ourselves.
Yeah, absolutely. Yeah.
Well, I think it's very clear why this is important for women in general to be educated about this and feel comfortable talking about it. Why is this specifically important for the veterinary field and probably most professional fields? But of course, our expertise is in the veterinary field.
I think there's some really specific things that apply in practice that don't necessarily apply to other fields. So a lot of it is, we're meeting clients every few minutes. Our reception team is sort of meeting and greeting people and dealing with people on the phone whilst they might be having hot flushes and needing the toilet. Our clinical teams are dealing with patients, dealing with clients. So we have to have that sort of professional public facing, which can be quite intense. And if you are experiencing things like sleeplessness, fatigue, loss of concentration, it can actually really knock your confidence as well, and really impact how you feel in your day-to-day role, and your productivity. Even cross industry, there's a lot of research to show that potentially the loss in productivity due to menopause can be quite important from a revenue perspective as well. So by helping people to kind of perform at their best, then we're actually helping the business as well as helping those individuals. Some of the particular things around veterinary as well, lifting heavy dogs, or whether you're out in the field, an ambulatory vet, with cows and horses, etc. A lot of the symptoms can be things like joint stiffness, and particularly in things like the fingers. So that kind of fine motor skill can be impacted as well. So just that general awareness and understanding that because we have a very professional public facing role, because we also have quite a physical role, actually both the psychological and physical symptoms may well impact us at work more than, say, other professions or other industries. Also, you alluded to it earlier, we are predominantly a female industry now, and, we have to really be conscious of that. And then we're likely to, with the increase in percentage of veterinary students being female, then the sort of increasing femininity, if you like, of the profession is potentially going to increase. A lot of our sort of reception teams, our client care teams, our nursing teams are even higher percentage female. So as an industry, this is proportionately going to impact us more than other industries. So we could really lead the way on this. We should be. I mean, why shouldn't we be? We're a, science-based female dominant profession. So let's really take this by the horns and let other industries and professions come to us and say, oh, look what the veterinaries team is doing, because that's really, we should be looking at that and learning from that rather than the other way around.
Gosh, yeah, we really do kind of present a great model for figuring some of this out because, of course, like you said, we're female dominated, but then a lot of the challenges that menopause and perimenopause would create, the concentration and that professional persona, as well as the physicality, which is certainly somewhat unique to our profession. Yeah, I think we really have an opportunity there to lay some good groundwork.
Yeah, and that's why I'm so delighted that Chewy, along with other sponsors, have helped us create veterinary specific menopause resources. I didn't find anything else out that was veterinary specific. There's lots of sort of cross industry things that people are sort of looking at and trying to sort of retrofit to veterinary. But it's been really nice to sit down with subject field experts and get them to produce a suite of free access resources for veterinary teams around the menopause. So they really do suit our particular needs as an industry and in our clinics. So I'm delighted that that's happening. I'm also trying to champion further research. We did a survey in the UK around menopause and its impact on veterinary teams, which is published in the Veterinary Women Menopause Report. But I'd really like some more thorough, in-depth research. So I'm exploring that with a research from the University of Edinburgh to try and get some funding and really get some more in-depth research into the specific impacts of menopause for veterinary teams.
That's fantastic to make the knowledge much more easily accessible, especially for how it impacts veterinary teams specifically. And I think what you're illustrating here, the talk we're having right now, certainly, I've had experiences with clients in exam rooms that make me feel like some of the stigma is being reduced around having these conversations. It is not uncommon at all for me to see a client who says, "Can I take this jacket off? I'm having a hot flash." And, for that to be a perfectly fine conversation to have. But it sounds like there's still a lot of work to do to really increase awareness around menopause and make those necessary accommodations. What are some of the challenges you see surrounding this effort to increase awareness about menopause?
Yeah, so what we don't want to inadvertently do is almost increase any negative bias. So what we don't want is to say, well, did you know there are all these symptoms? And then to sort of have that unconscious bias build up in people where they say, well, oh, this woman's coming to that age and stage of life. Maybe we won't offer them the promotion because they might be suffering from, coming into the stage of experiencing some of these symptoms, which might impact their performance. That is not what we're saying. What we're saying is we need, support for the individual if needed to, make sure that they are able to perform at their best. But as we discuss these topics, there is that potential. So I want to make it very clear that we all need to be kind of cognizant that that could be an unintended side effect, and to kind of actively work and with the unconscious bias, the whole point about it is it's unconscious. We have to do the work and explore our own unconscious biases, and I would say this is another area that we have to do that. So whilst we're raising the conversation, we don't want any sort of bias to increase at the same time. And I think the other big challenge is it's uncomfortable, right? I mean, sort of going into your, particularly if you're a female, maybe going into your older male boss, if you have an older male boss, and saying, so I'm kind of having these perimenopause symptoms. It's a challenging conversation. It's also, I've been talking to a lot of men as well, and it's a challenging conversation for them. Maybe they really want to help and they're not really sure how to broach that subject. It's because it has been a taboo. Women's hormones and women's health have been a bit of a taboo. So that can be quite challenging for them. So I think we need to do some work around supporting leaders, male and female, but particularly, empowering our partners, our male partners, our, male leaders, our sons, our brothers, and helping them have this conversation, because a lot of them want to support, they just don't know how. So that's something that there is kind of leadership training out there that you can do around menopause and how to have the conversation. And part of developing a menopause policy is almost having a framework that you can work through to have those discussions with your team. And my husband, bless him, he's a builder. And he works on a site with other sort of builder plumber friends, And they've actually started having conversations about menopause because their partners have struggled with some of the symptoms, and it's impacted their relationships so much. And the first guy kind of came in and very sheepishly like, oh, we're having real trouble. And it almost resulted in their breakup of their marriage. And then his wife got treatment and he's become a complete evangelist. He's like, oh, if your wife's, having a difficult time, you really need to be supportive and help her. And, maybe she wants to go to the doctors, go along with her so you can learn about it as well. He's like this menopause evangelist, with all his tattoos and his, work shirt and everything. It's great. So I think men have a huge role to play in sort of helping us and supporting us, to have this conversation, and also to champion better healthcare, us taking care of ourselves, but also better healthcare for women that are affected as well.
I love that story so much. I'm picturing this person really, advocating for women after that experience. And wow, yeah, if someone in a predominantly male environment where that certainly wouldn't be a natural topic of conversation can educate himself and become comfortable talking about this and really, help us advocate for, hey, maybe we need these accommodations during this time because it really is a significant impact for us, physically, mentally, hormonally, then I think we can all learn to do a better job having this conversation.
Yeah, absolutely. And in fact, one of my biggest sort of champions in the UK has been the British Veterinary Association Senior Vice President Malcolm Morley, who has just completely taken this conversation and championed it. I know he's been over to sort of North American events and spoken at a Canadian veterinary conference on, and sort of weaved menopause into that as well. And he said, it really has sort of struck him how people come up to him afterwards. And that's the one thing they want to talk about. They're like, you were a man on stage and you said the menopause. And it's almost like, big sigh of relief. Oh, we can talk about it now. What a relief. I've just started a Facebook group, just an open access veterinary menopause chats Facebook group, because people are just wanting to have this conversation and talk about it more and more. And this is why podcasts like this are great. And we just need that sort of peer support network. We need to be people talking about it at conferences, men and women, and just sort of, yeah, this is a really significant, important thing. I mean, what other medical and physical health malady that impacted everything from cardiovascular to mental health, that impacted more than 50%, in our case, 60, 70% of the working population for a decade or more of their life? What other malady would we just sweep under the carpet and go, we don't really need to talk about that? If it was like if it was a kind of cellular thing and, it had an oma at the end of it, and then we'd be going, oh, look, there's endocrinoma. Let's talk about that and let's do lots about that. But, because it's this sort of physiological aging thing, all of a sudden, we shouldn't talk about it. What rot? We need to be having this conversation for sure.
Absolutely. And talks like this give me so much hope for having this conversation and so many of these important conversations about, what's truly going on in our lives and really being there and supporting each other in all the ways that we can. So Dr. Liz, thank you so much for joining me. Thank you for this amazing talk, all of the wonderful information, and all of the amazing work that you're doing.
Well, thank you so much for hosting it. I think it's such an important conversation. I've really enjoyed it. And thank you so much to everyone that's taken the time to listen. Please take this conversation, have it with your team, share it. I think this is one of the most important conversations we can all have.
And a big thank you to Chewy Health for continuing to foster important conversations in the industry, for example, by sponsoring this Vet2Vet episode, and for supporting Dr. Liz in her work to bring menopause awareness to the wider veterinary profession. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.